Chapter 4, Segment 1, pages 103 through 111. The effects of a drug depend on its site of action and its dose. When people think of a drug, the common idea is that they are used for treatment of diseases. An example would be over-the-counter drugs or prescription. Psychoactive drugs are compounds that affect conscious experience by altering the function of the brain. These are useful in clinical settings. Drugs of abuse are some psychoactive drugs that are used recreationally, and they vary in their risk the way they pose to their health. Some drugs affect the brain by altering enzyme action, or by modifying other cellular processes. Receptor ligands are of most interest to neuroscientists. Drugs fit like keys into molecular locks. Certain neurotransmitters interact with many different subtypes of receptors. This allows us to develop drugs that interact with one or a few receptor subtypes. The many subtypes of receptors are scattered throughout the brain, and they all serve many different cellular functions. GABA may have a large variety of receptor subtypes. It is dependent on the sequence of proteins that make up the receptor. Evolution affects the structure of receptors more than the transmitters alone. When drug molecules enter the body, they disperse themselves all throughout the body until they come across a receptor that matches its shape. They'll then bind to that receptor temporarily, and it will set off a sequence of events. Drug-receptor interactions vary in specificity and activity. Some drug molecules affect more than just one type of receptor, which gives the molecule flexibility to bind to different types of receptors, and thus it creates different reactions. For an example, low doses of a particular drug can reduce the anxiety without sedating someone, but the same drug given at a higher dose, it can produce sedation. This means that higher doses of a drug can activate additional types of receptors that are not active when you have the lower dose of the same drug. Binding affinity is the degree of chemical attraction between a ligand and a receptor. The higher the affinity, the lower the dose needed for the molecule to bind to the specific receptor, as well as the receptor and the molecule will bind for a longer period of time when the affinity is higher. Efficacy is the extent to which a drug activates a response when its receptor and it binds. A partial agonist produces a mid-response, where the drug binds and what it does determines the overall action of the drug. Dose-response relationships reflect the potency and safety of drugs. The dose-response curve, or the DRC, shows the relationship between drug doses and observed effects. This is one of the main tools for understanding pharmacodynamics, which is the functional relationship between drugs and their target receptors. The DRC shows the effective dose range of a drug, and it allows us to compare that with efficacies and potencies of other drugs, and this allows us to compare two drugs, and we can determine which one is safer. Sometimes the DRC reveals that the drug may be binding to more than one type of receptor. Repeated treatments may reduce the effectiveness of drugs. Tolerance is a drug's effectiveness diminishing over repeated treatments. So just as our body systems change, they're functioning to help us adapt to the environment. Drug treatment is a change in the body's chemical environment. This results in needing higher doses each time to achieve the original effect. There are types of tolerances. Metabolic tolerance, which is when the body's metabolic system and organs become increasingly effective at eliminating the drug from the bloodstream before it has had the chance to affect brain or any other target. Functional target, on the other hand, is the target tissue shows a decreased response to the drug after repeated exposure, usually as a consequence of up or down regulation of receptors. Downregulation is when a neuron decreases the number of available receptors to which a drug can bind. So this happens after repeated exposure to an agonist drug. Neurons will downregulate, making them sensitive and counter the effect. become less sensitive and counter the effect, whereas upregulation is when a neuron increases the number of receptors a drug can bind to. With antagonist drugs, the target neuron may upregulate and become more sensitive to the drug effect. Cross-tolerance. When an individual develops tolerance for a drug, usually tolerance for all other drugs of chemical class will develop. For an example, if you develop a tolerance to heroin, you are going to have a tolerance to many other drugs in the opiate class. Withdrawal symptoms are the unpleasant sensations a person develops when they stop taking a drug that they have been, especially if they were using it at high doses. A major cause of these symptoms is believed to be tolerance to a drug. One of the main things that maintains drug addiction would be the unpleasant symptoms and physical pain. Sensitization. When drug responses become stronger than with the repeated exposure, thought to contribute to the cravings an addict may experience. This could last for a prolonged period, and it is also associated with long-term brain changes by altering the function of the mesolimbocortical DA reward pathway. Drugs are administered and eliminated in many different ways. A drug's route of administration plays a role in how much of a drug gets to the brain and how fast that drug will begin to act. Bioavailability is how much of a drug is free to act on the target tissue and therefore not bound to other proteins, or is it in the process of being metabolized or excreted from the body. Administration via smoking or intravenous injection quickly increases the concentration of a drug that is bioavailable in the body. Duration of a drug effect is determined by the way it is metabolized and excreted from the body. Biotransformation. Process of enzymes converting a drug into metabolites, which are inactive and sometimes in ways that are considerably different from the actions of the original substance. These can produce unwanted side effects. Pharmacokinetics. Collectively, all of the factors that affect the movement of a drug into, through, and out of the body. The blood-brain barrier. Tight junctions between the endothelial cells of the blood vessels within the central nervous system that inhibit the movement of larger molecules out of the bloodstream and into the brain. The blood-brain barrier causes problems for neuropharmacology because many drugs that can be useful are too large to pass the barrier into the brain. Though, some drugs utilize the active transport systems that carry nutrients from the bloodstream and into the brain, and they sneak past the blood-brain barrier. Drugs affect each stage of neural conduction and synaptic transmission. Local anesthetics. A drug that blocks sodium channels, which hinders neural transmission of pain fibers. Some drugs alter presynaptic events. A drug can change synaptic transmission by altering the behavior of the presynaptic neuron, resulting in the change of a system that converts electrical signals into chemical signals. Three main categories of the most common presynaptic drug effects. These are effects on transmitter production, effects on transmitter release, and effects on transmitter clearance. Transmitter production. For a presynaptic neuron to produce a neurotransmitter, the axon terminals must receive a uniform supply of raw materials and the enzymes that use that to synthesize transmitter molecules, vesicles, and other components. Some drugs will alter this process. Presynaptic membranes that have been affected are prevented from having their normal effect on postsynaptic neurons. For example, a drug inhibits the enzymes that neurons use to synthesize a particular neurotransmitter, which results in a depletion of that transmitter. A third class of drug, which is reserpine, interferes with neurons' ability to store catecholamines transmitters in synaptic vesicles for later release. This interference has the effect of depleting transmitters at catecholaminergic synapses. Effects on behavior depend on whether and how much transmitter reaches the postsynaptic cells. Transmitter release. Many different conditions and agents can inhibit the release of transmitters when an action potential reaches a terminal. For example, the compounds like tetrodotoxin block sodium channels, which prevent axons from firing action potentials. This will shut down synaptic transmission. The drugs called calcium channel blockers block the influx that normally drives the release of transmitters into the synapse. Some toxins will prevent the release of specific types of neurotransmitters. For example, tetanus bacteria produces the toxin tetanospasm, which interferes with the molecular function that causes synaptic vesicles to bind to presynaptic membranes. This will block exocytosis and cause a loss of normal inhibitory influences on motor neurons, which results in strong involuntary contraction of the muscles. Some modify the systems that neurons usually use to monitor and regulate its own transmitter release. Autoreceptors are presynaptic neurons, and they are utilized by monitoring how much of a transmitter they have released. It resembles a type of feedback system. Drugs can alter autoreceptor signals and provide a false feedback signal, which prompts the presynaptic cell to produce more or less of a transmitter. Adenosine is an endogenous ligand. A neuromodulator that is normally co-released with primary transmitters controls synaptic activity by blocking transmitter release. Caffeine acts by inhibiting the autoreceptor effects of adenosine, which increases the release of catecholamine and results in arousal. Transmitter clearance. Immediately after release, the transmitter is cleared from the synapse until it is gone. Because until it is gone, the release of new transmitters from the presynaptic side won't have much of an effect. A larger reduction of synaptic transmitter availability may contribute to disorders like depression. There are multiple pharmacological strategies for modifying the clearance process. Transmitter reuptake is the absorption of synaptic transmissions by axon terminal from which it was released. Transporters are specialized proteins that remove neurotransmitter from the cleft for reuse. Some drugs interfere with transmitters reuptake by blocking transporters. For example, antidepressants often inhibit the reuptake of serotonin, which permits the transmitter to accumulate and have a greater effect on the postsynaptic cell. Degradation. The chemical process of breaking down neurotransmitters into active metabolites. Some drugs inhibit degradation, which will have a similar effect to blocking transporters. They allow the accumulation of a transmitter so that the transmitter will have a greater effect on the postsynaptic cell. For example, agents that inhibit the enzyme acetylcholinesterase allow acetylcholine to remain active at the synapse and alter the timing of synaptic transmission. This includes pesticides and chemical weapons, and they produce prolonged contractions of muscles and result in paralysis, as well as overactivity of the parasympathetic nervous system. Drugs may act postsynaptically. A way drugs can affect synaptic transmission is by altering activity of the postsynaptic cell. Two major classes of postsynaptic drug reactions are, for the first, direct effects on transmitter receptors. The second is effects on cellular processes within the postsynaptic cell.